here today with Dr. Peter Gorman from MicoGaitUSA, and we are discussing sports performance. And today we are going to talk about ACL injuries and what we can do as professionals to help prevent them and help our athletes succeed.
So, always a pleasure to be here with BFS, and unfortunately those three little letters, ACL, have caused almost a crisis around America, and we're seeing problems with young athletes, male and female. Actually, female athletes, I think we're on a dramatic rise. The ACL was extensively studied, and there's a great protocol done by who I consider the boy genius himself, Kevin Guskowitz, University of North Carolina, Chapel Hill. He came up with the landing error scoring system, LESS. And it's a quick understanding of what your biomechanics look like under load, and depending on what they look like under load in this little test, what's your susceptibility to injury. So what we've learned over time is that if we can get the athlete at an early age, and this is what we've talked a lot about at Bigger, Faster, Stronger, to get them training properly to correct their fundamental flaws of movement, their valgus varus exposure, their knee in, knee out at the knee, their hip rotation. You know, females have a little predilection because their pelvis is shorter and wider than a male pelvis. And there's this little word, and without getting too fancy, your Q angle. As your femur comes down and approaches your patella, there's a little angle there. So it all boils down to balance, coordination, and timing. So what we do at BFS is before we load strength, just like any house, before we build that house of athleticism, we make sure we have a strong foundation. So we're constantly looking for proper form. We're always looking for symmetry of movement. And then as we conquer form and symmetry of movement, then we can load the athlete. And the ACL injury itself, we could go through a couple of simple tests for it. One is stability. So we do our static balance test at BFS. We do our landing error scoring system where we jump and look at the biomechanics and mark the athlete. And then the other thing that's a little bit of a hidden factor that hasn't been talked about much is the soleus muscle. It's our muscle of propulsion, okay, and that's what all movement is about. But if you already have a contracted soleus muscle, and it's very easy to test, it increases your posterior shear on this ACL ligament. So a very simple test that can be added to the landing error scoring system and to making sure that you have proper biomechanical movement on your lifts in the BFS program is to have your athletes stand tall and they squat down to the floor. They should be able to lower their butt all the way to the floor and keep their feet flat on the floor. If they need to raise their heels off the floor to allow their butt to descend down, then you know you have a contracted soleus, and then we can use products as simple as a tiger tail rolling muscle massage that you sell in your catalog to help reduce the trigger point. So the ACL injury, commonplace, but there's some very nice tests and some very simple maneuvers now, and that's why it's so important to do that BFS training early so that you're not creating compensatory processes for an underlying weakness just because you want to load more weight.
Thank you, Dr. Gorman. That was great stuff.
Anytime, my friend.
For more information, you can go to biggerfasterstronger.com.